Participants will be in listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen.
Thanks, Susie, and thanks everyone for joining us again today for another session in our Cause and Effect series. If you've attended before, you know the Cause and Effect series is all about why is my student struggling to learn and how can I intervene. If you're with us on Tuesday's session with Dr. Pfeiffer included interventions for reading comprehension, and we're very excited to have Dr. McCloskey with us today to continue that discussion with a deeper dive into executive functioning. Just a note about the handouts. They were attached to the reminder email that was sent yesterday. Please check your spam or junk folders, but if you did not receive, be sure to use the chat box to share your email address with me, and I'll forward those handouts to you once we get started. And with that, I'm happy to introduce Dr. George McCloskey, a professor and director of school psychology research in the psychology department of the Philadelphia College of Osteopathic Medicine. Dr. McCloskey is the lead author of the text Assessment and Intervention for Executive Function Difficulties and Essentials of Executive Function Assessment. Dr. McCloskey, we're so glad to have you with us again. Please begin once you're ready.
Okay, thank you very much, Andrea. Appreciate it. Good morning, folks. Welcome. We appreciate that you are here today, such a busy time of the year, that you could make time in your schedules to do this with us. We want to talk about executive functions today and reading, and I know in the title it says learning to read and reading, and I think that's a critical piece that we want to talk about a little bit today, in that the way we use our executive functions when we're learning to read is a little different than the way we want to use them once we know how to read and are performing the act of reading fairly competently. So we want to make that distinction as we go today. We are going to talk about this kind of a continuation of what we talked about with written expression and math. There are some common core elements here, but much of the content here that we'll be covering certainly will be directly related to reading only. I am drawing heavily from Virginia Berdinger's work here in Brain Literacy for Educators and Psychologists. The book that I have out now on Essentials of Executive Function Assessment will reference a few of the things from that also for the assessment component. So we have some basic concepts that we want to talk about today in this process of how to read, and processes, abilities, skills, lexicons, executive functions, strategies, achievement, memory. These are all components that are critical in understanding reading and how we read. The model that I'm suggesting to you here is that we use our processes, abilities, skills, and lexicons. During the process of reading, we'll discuss a little bit about what each of these are, but not very much time because we want to focus on the executive functions. But the executive functions integrate all of these components, especially through the use of strategies. Basically, when you have all these components functioning effectively, then you can achieve, and you use the mind frames, the memory time frames are important here, the immediate memory, working memory, retrieval from long-term storage. All those need to be integrated as you're using these capacities to perform the act of reading. As you do that, if you are using these all effectively, then you will have a high level of achievement in reading. So when we give you an achievement test that requires you to read and you do well, you're using these to some degree to accomplish that success. When you're not reading well, then the difficulty is that when the achievement is low, we don't know which of these components is the difficulty, whether it's a processing issue, whether it's ability, whether there are skills you haven't learned, information you haven't stored in lexicons, not effectively using strategies, have some working memory difficulties or other types of memory difficulties. Any of those can affect achievement. What we want to focus on today, though, is how the executive function components can affect the achievement. So even when all those other components are there and you can test them individually and they look effective by themselves, when you put them all together and integrate them in the act of reading, that's where the executive functions come into play. So in the model of reading here, like we had one with written expression and writing, we're looking at the initial registration of information. You look at the page and you see the information on the page. In order to get the information off the page and into your brain, though, there are some things that you have to know already. There has to be stored information about the act of reading, which we often call our pre-reading skills, which is our knowledge of orthography. You need to know about letters. You need to know that they form words. You need to understand sounds and how they relate to letters. So orthographic and phonological information does need to be learned and stored prior to your ability to take that information and then use your processing capacities to get the information off the page to the right parts of the brain to create meaningful representations in your mind of what you're reading. So that's how we use our phonological orthographic processing to get that accomplished, oral motor functioning, is a piece also that's critical here in terms of your subfocalization as you read, or if you're orally reading, you need to use your oral motor functioning. The better at it you are, the faster you can read. So these processes form impediments to effective learning. If you have process deficits phonologically or orthographically or oral motor, it's going to be more difficult for you to pick up the skills of reading, which are decoding unfamiliar words, recognizing sight words, and speed and prosody, which we often call fluency. Those are all critical basic level, word level skills that we build on top of the processes. We need to understand the meaning of words, so we have semantic lexicon built in terms of what words individually mean. There are phrases that we need to know the meaning of that we store and know. We obtain those through our language experience and through instruction. There are abilities that we want to use during reading. You have to have basic language capacity to read. If you don't, you'll be severely language impaired. You probably won't be reading. We may need to use reasoning as we read to figure out complex arguments that we're reading about. Visual spatial is the act of translating language into visual spatial coordinates. The pencil's in the backpack's in the locker. Go get it. Okay, do you understand from that language where you're going? Do you have a visual image in your mind of what you're supposed to do? So visual imagery becomes very important in the act of reading. When you're reading, you need to create images of what's going on and what's happening, in some reading more than other situations. And then, of course, that's comprehension is a skill that we teach, and it requires those knowledge bases and those capacities to reason, to use language, and to have visual spatial capacity for translating language in order to comprehend effectively. So there's the skills that we teach, there are the lexicons, the abilities, the processes, working memory. The longer you have to do this process in time, the more working memory is required. So that's the basic structure here of what we're talking about with reading. As far as executive functions, I'm going to bring those in a minute, but first let's just look very quickly about what we talked about here at the knowledge stores. The abilities that you need, the processes and functioning, and the time frames of reference, all those we mentioned. And the reading skills, sight word recognition, word decoding, reading speed, reading comprehension. These are the skills that we teach. The difference between a skill and an ability is that we often think that we can't teach the ability. You need to have it in order to do well. The skill is something that we teach. And of course, with reasoning, we want to be thinking about reasoning rather than ability as a skill, but it's still not on my list right here. But it does play a great part in learning how to comprehend in reading. And the more we can teach reasoning through the process of teaching reading comprehension, the more effectively we're changing that ability of reasoning into a skill that we teach. Let's look at a study here very quickly. In terms of the way we use these, we want these skills that we have in terms of reading, especially word recognition, we want to have that automated to the degree that we're not using our frontal lobes or our executive functions to really drive the act of reading words on the page. The more words you know by heart, and you can say, but once you know the words, or once you have had experience with a task, or you memorize what you're supposed to do, the information on the page is what's cueing you completely. You're not using the instantaneously. The less involvement you need with executive functions to perform the task. Something that's similar to what you practiced, but a little different. So we see that reactivation of the language automaticity. And we do and we don't. See, here's the thing. The actual decoding is a skill that you learn. Once that's learned, it becomes a lexicon that's stored. You have to retrieve it. You can use it to automaticity. In other words, you know coding. But what you do need to do is to use your frontal lobes, and you know what you need to do, which is use your decoding skills. So now we don't need our frontal lobes to do this decoding task, though it can creep in. We'll talk about that a little bit, and affect your performing skills, and you're good with orthography and have good attention to orthography, you will do that automatically. And some of the words in the passage may be words that you don't know. Now, it's not a matter of automatically drawing on your decoding skills, because basically your decoding skill goes for, though, if you're aware of the fact that you may not know all the words on the page and have to use decoding skills to sound them out, you now need to use your executive functions to monitor your reading and recognize when you come to a word that you don't know. To decode, stop, shift, bring your decoding skills online. So now you realize that you have to use executive functions in order for you to get everything right on the page if you don't know all the words on the page automatically. The worse your reading skills, the more you have to decode, the more you have to use your executive functions to monitor your reading to make sure that you shift from automaticity of reading sight words to decoding words. Otherwise, you just blow them off, go by them, say whatever you think is on the page, and keep going. So, and you see a lot of kids that do that. So what you begin to realize is that when I know you can decode words, but then I give you a passage and you don't decode them in the passage, and I have to keep saying to you, what was that word? Go back. What word was that? And you can decode it when I send you back. See, now I'm your frontal lobe. I'm your executive functions doing the monitoring part for you. And when I see you make an error, I let you know, and you go back and correct it, which tells me you have the decoding skills. You don't have the executive capacity to do the monitoring yourself. I have to do the monitoring. So the ideal then is to teach the individual through various ways that we'll talk about here in terms of instruction, how to get that monitoring into their own heads so they do the monitoring instead of you. Otherwise, they have to be assisted, and that's the executive function part. So you can begin to see here the difference between the skills that you use in reading or the lexicons that you draw on automatically when you're a good reader versus the kind of executive functions you need in order for you to direct the reading process when you're a poor reader. And the fact it's paradoxical, but the fact of the matter is poor readers need to use more executive functions for lower-level skill production. In other words, word-level reading, instead of devoting their executive function skills to the upper-level skill of comprehension. So in our model then, what we see in the next slide here, rebuilding our model again, with our lexicons, processes, abilities, and skills, and all those being developed, and then the use of working memory, executive functions in this model are everywhere that you see red arrows. So executive functions are responsible for cueing, coordinating, and directing all of the components mentally that are required to read as you perform the act of reading. It's necessary for that integration piece. So you may know how to read words quickly and automatically and accurately as long as you know the word. But if you have to engage decoding skills and integrate those into that process, you need executive functions to do that. Just even maintaining an appropriate rate and using prosody when necessary is a decision you need to make with your brain, which requires executive functions. Actively participating in the text and asking yourself questions as you go so that you can get maximum comprehension from what you read requires executive functions to cue yourself to do that. So there's all these components that you use in reading, and the executive function piece is remembering to use them all and to do them and cueing them when necessary. So here are numbers that go along with all those arrows, and here are verbal statements related to each of those numbers. And these are the different things that you cue and coordinate when you're reading. There are at least 10 of them there. We'll talk about them a little bit more in more detail as we go here. So in terms of executive functions and what they do, they are directive capacities of the mind. There are many executive functions that are housed in the frontal lobes, and that's where they're located. They cue and direct the other parts of the brain to do what they need to do when you're performing a particular act. But they don't just cue. Well, the parts of the brain that they cue is important to know. They basically cue perceptions. How do you take the information in? They cue emotions. How do you feel about the information that you're processing? They cue thoughts. What are you thinking about? The idea of engaging in the process of reading. So if you have that kind of emotional difficulty with reading, we have to address it, figure it out, understand it, and act on it, and help the individual get past it. Because the fact of the matter is, if you have a reading disability, whether you need to use executive functions or not to do the reading task that you're being assigned, if you're not emotionally engaged, it's not going to go well. So we have to have the brain emotionally engaged in order for the executive functions to be able to direct effectively. And of course, the executive functions can be drawn on to take control of the emotional center of the brain to say, look, I understand that you have difficulty reading, but here we have to get this done. And the true paradox of this is, the more difficult reading is for you, the more of it you have to do. So the thing that you like to do the least is the thing you have to do the most. If we can't help you figure out how to use your executive functions to get control of your emotions so that you can accept that reading is something you have to do, and maybe even something you enjoy to do at some point, it's not going to go as well as we would like. In fact, you may not be available for instruction for large portions of the time we're trying to educate you. So this kind of ties into a second piece of executive control here that we're talking about, which is the internal demand pathway and the external demand pathway. If reading is externally demanded of you by others, it's going to be more difficult for you to get your brain where it needs to be to use your executive functions to direct the reading process than if you like to read or want to read the passage. Then it's internally commanded. So we see the reward center of the brain. If you like something, if there's something you want to read because you like it, and it's going to give you information that you need, then you are going to be engaged in the reading process more effectively, and you will be using your executive functions to the maximum extent that you can use them or you have them to use when reading, because you're engaged, critical, and that really engages us in self-rewarding reading. So when we want to do it, there it is. But of course, if it's something that I want you to read, external demand, now I have to consider the fact that I'm trying to get you to come over here with your executive functions and direct the reading process for me, for you to read something that you don't necessarily want to read, but that I want you to read. I'm just reflecting on a 15-year-old that's my son, that we've had some very interesting difficulties with that related to an AP history course and reading all the material. So reading the things that you don't want to read becomes very difficult. And how do we get the brain over here to do that reading? And, of course, our answer very often is that you just get your butt over here and read it. Your desires should be my desires or my demands, and they should be consistent. And if that's the case, then we've got this nicely aligned. But, of course, that's really hard to do with a teenage brain or younger. And so we often have extrinsic rewards and punishments. Well, if you come over here and do it for me, I'll give you this, or I will apply this punishment. So we try those means, and of course sometimes they will get the brain there, but for executively deficient brains, often they don't know how to get there, even if they want to get there, which sometimes creates a situation where all the rewards in the world won't do it. They'll never get the reward, and all the punishments will make a difference because they'll continually be punished and dig a hole so deep they can't get out of it. So we really have to understand when an individual is incapable of using their executive functions to get themselves motivated to read, we need to really appreciate that and possibly come over here and use this pathway where we are aligning the external demands with the internal desires. Okay, what do you want to read? Okay, let's read that. And if it's really good, you can read more of it. So sometimes we have to take that approach to first get into the brain to develop the capacity to read first, and then we can work on that other pathway and bring it over this way over here. So we've got this pathway that we try to force kids to do with rewards and punishments. We have this pathway where we can align our demands with their desires. That's great. We have that third pathway. Ideally, we want to learn how to traverse that pathway where you can read things you need to read simply because you need to read them. And hopefully you can see that in the long run, there will be a payoff for you as well. I mean, it's really hard for anyone to engage in something if they don't believe in any way that it's going to get them anything out of it. So that's the problem we have with some brains in terms of executive functions. In terms of applying it when you're actually doing the reading, though, is we're going to turn to that and look at that. But appreciate that when we have to use executive functions to drive the reading process or the act of reading, then what we begin to realize is that the producing difficulties related to the difficulties with the use of executive functions are different than learning disabilities or difficulties with reading that are due to your inability to use your processes, abilities, skills, or lexicons to do the reading act, or poor working memory that will affect reading. So what we begin to realize then is there's a difference between a learning disability and a producing disability. And if you have both a learning and producing difficulty, you will get recognized early, and we'll probably work with you very early on your reading skills because we think you have a reading disability. But if you, in fact, have a reading disability but have good executive functions, you can hide your reading disability for a long time because you're producing for us. You're doing the best you can to figure out how to get words off the page into your head and processed. And so you may be memorizing sight words like crazy, but not know how to decode to save your life. You can hide that for a long time, and we don't think you have a learning disability because you're using your executive functions to figure out how to compensate for your reading disability. The kids like this often aren't picked up until junior high or high school, and when the reading demands become so great that they're having a hard time keeping up with that, using their executive functions to stay afloat. That's when we begin to notice them. And usually they're still getting passing grades, so it's usually the parents that notice it and not teachers, which is a difficult situation. They're getting A's and B's, go away, but in fact it's taking them so long to read the material at home, which is what the parent is concerned about. So this is legitimate. We see that when kids have executive difficulties or learning disabilities but no executive problems, that can create as many difficulties as the opposite, which is down here, where we check you out. You're not producing. You're not reading in class. You're not getting the job done. We take a look at your production. You get referred on the basis of production. We do an evaluation, and we look at individual skills, individual abilities, individual lexicons that you've built, individual ways you process information, and all of that checks out. It looks good. And so we say, well, you don't have a reading disability, so I don't know why you're not reading. You must be lazy, unmotivated, could do it if you wanted to. What we often are not checking out is how the individual needs to use their executive functions to integrate all those pieces that you just evaluated and checked off as being adequate. What happens when they have to integrate them all in that controlled and consistent act of reading over an extended period of time? When multiple paragraphs are given to the person to read, how do they use these skills in doing that reading? And if you do the kind of assessment we're talking about here in the rest of our webinar, you'll be a little bit better able to identify these executive function difficulties and how they creep in to affect the reading process, especially for students where everything seems to be checking out, or if they have a reading disability and we're addressing all these skills and lexicons and abilities individually through our instruction, but they don't seem to be making progress. I get a lot of independent evaluation requests for students who are in special education receiving really good reading instruction from a balanced literacy perspective with all the right strategies in place, yet they still don't seem to be making the progress that we would expect. And when you look at it closely and everything checks out, it's the executive function piece that's still missing. And so in those cases, the solution there is to stay the course, do what you're doing. Don't change it, don't alter that, but also more practice in the integrated act of reading. Where do they get a chance to put all these skills, abilities, lexicons, and processes together to perform the act of reading for an extended period of time? If they don't do that, then all of your individual teaching of all these individual components is not going to provide the level of expertise in reading that we're looking for, or efficiency in reading, because they're not practicing the use of executive functions enough to run their reading show. Without that piece in place, all the good instruction we do will not produce the kind of reader we want until the brain matures and catches up with the instruction that we're providing it. So at some point, it likely will kick in. We can try to get it there faster by using the kind of techniques that we'll be talking about to practice the use of the executive functions to run your reading show, so that possibly you can get there sooner than what your maturational system suggests that you will get there at what point in time. So let's just step back here, and one of these is very important to understand, this orthographic processing component, one of these components related to reading, because it's one of the most important ones to get executive control of. We practice it to automaticity. We recognize words on the page. We read them quickly and efficiently, so you have to have that orthographic knowledge base stored. And the more words you know, you see what the letters combinations on the page. You go to the lexicon, you withdraw the word, you say the word that you see on the page. You're able to do that effectively. Your immediate memory is not a problem. Your attention to orthography is not a problem. See, if all those components are there, you're integrating them with executive functions, it becomes automatic. The more automatic that orthographic processing becomes, the less the executive demands are, and the less you use executive functions to run your orthographic processing component. But what often happens with many individuals is that all these components are there. The lexicon is being built. The capacity to perceive the words on the page is there. The immediate memory capacity to hold those words long enough to see the word and say it right is there. The problem is a lack of direction of attention to orthography. The individual can attend to orthography and see the letters. The problem is they often don't, because they're not using their executive functions to recognize the need to do that effectively. So you have this a basic component here of the visual processing system is to want to go pattern on us instead of detail. And in reading words, you have to stick with the details. If you go pattern in your processing, you're less likely to pick up all the letters in the word, and then you end up saying a word that's not on the page. So we know this from perceptual psychology research that, we are able to see a young woman in this picture much more easily than an older woman. But when you look closely internally at the details, instead of grabbing the global pattern of the young woman, you're going to look internally to see these details of the nose, the mouth, and the chin, and you see the old woman embedded in the center of the picture, which then suggests an overall pattern after you see the details. But you have to see the details first to see the old woman. Otherwise, you just see the young girl. and you quickly say it's a young woman. So this is what happens. We're talking about the difference between detail processing and pattern processing, or local and global processing. That's the detailed description of what we just did there. Interesting, this is the original image of that ambiguous picture I just showed you. Looked like this when it was first published. And the title of this appeared in Puck magazine in 1918. It's a satire magazine, and this was titled My Wife and My Mother-in-Law. Interestingly, in the original, it was a lot easier to see the old woman than the young girl, but they made it more ambiguous for perceptual psychology so that you're typically pulled toward the younger woman. Now, even knowing that what you're doing here, it's difficult for individuals to see a Native American and a Native American in this picture. Most individuals will global process, do the pattern processing, see the head of an American Native Indian chief, but they often don't see an Inuit looking into a cave with a parka on. And you can see the hand and the boot, and you're seeing the back of the parka as the individual looks into the cave. You can't see that image unless you do the local detail processing that we talked about. So shifting from pattern to detail processing is hard for the brain to do when we're not looking at orthography. When we look at orthography, it's hard to do too, because we have from the word, but most people will try to pattern process to see the whole terms of seeing the word. Many people will jump immediately and know the word instantaneously, in which case they are global pattern processing, which is not good. Most brains keep glossing over when we're looking at things that aren't words, but we start doing that with words because it's the natural habit of the brain. So many individuals will recognize that E and R are different, that R and A are different, that EAR is a word, that REA is not a word, and they're different. But if you stick two posts on the page, B and D, and you put REA and ERA between them, lots of people will say bread for beard, because they're global pattern processing. They're not looking at every detail of the word, not looking at every letter, which is an individual detail, in order for them to stop and say, wait, I don't know that word. I have to decode it. Or try to figure out what it is, because this is what the brain just wants to do. It just wants to gloss over and keep going. So in order to use your decoding skills, you have to be able to recognize that you don't know the word on the page. And the brain wants to go so quickly to the lexicon to retrieve a word that you do know already that words can be like the elephant. They can be illusions that fool you. You think that what's on the page isn't there. You think it's what you know, and you say what you know instead of what's on the page. Training the brain to be very careful and to see attention to orthography, to engage executive functions, to control attention for orthography, is the critical component here that needs to be learned by the brain. Sure enough, every time I talk about this, people will send me this from the internet and say, well, what about this? And this is that idea that according to researcher in English University, it doesn't matter what order the words are in, the only important thing is that the first and last letter are in the right place. The rest can be a total mess. You can still read it without a problem. This is because we do not read every letter by itself, but the word as a whole. This is not true. One, yes, you can read that, but see, it's counter to what we just talked about, which is you need to see every letter of every word. Otherwise, you don't know what to say. So my reply to this is pretty direct. If you can figure this out in 11 seconds, then what he said was true. If it takes you longer, then it's not. A multitude of confused Internet surfers seem to believe that the order of the letters in the word doesn't matter when you're reading, as long as the first and last letter are in the correct position. If so, what hypothesis might they generate to explain why this cryptic message is exponentially more difficult to decipher by them? It's not the way the brain processes. It's a game you can play. The brain wants to see every letter in every word in the order in which it naturally appears, because regularity of orthographic regularity, is something the brain processes quickly and automatically, which enables you to see words quickly and automatically. But the problem is sometimes we see them too quickly and too automatically. And if we're a poor reader, we really have to counter that with looking very carefully at every letter of every word. And that sometimes is hard to teach your brain, because then we know the words and then we don't decode them when we're reading quickly and automatically. So we talked about that a little bit before. So to maintain now, how do we assess the effect of executive functions or even just visual processing? How do you assess visual orthographic processing? And interestingly, you can't do it with non-orthographic measures. So block design, Bender, Beery, none of those are going to tell you about the visual processing of orthography. That's a specific basic way the brain functions visually. Once you have loaded the letters and you process those letters, you're withdrawing that information from a specific part of the brain that is not involved with doing block design and design copying and all the rest of it. So you have to use words and letters and numbers if you're looking at orthographic processing. The PAL-2 has a subtest called receptive coding that does this. And basically, I'm going to show you two words. If they're the same, you say yes. If they're not, you say no. And basically then you show 1 per second the words. And if they're the same, they say yes. And if they're not, they say no. And you can see here that you don't know if a letter is going to change in the word or not. And so the only way to do this task is to have seen every letter of the first word and every letter of the second word in the order in which they appear and compare them in your mind's eye, which requires that ability to hold the orthographic information long enough to do that. If you do really well with this, then what I know is you are attending to orthography, holding it, and comparing it effectively. If you don't do well with this, you may have some difficulties just in basically orthographic processing, but very often I see inconsistent performance. I see runs of 5 or 6 or 7 right, 1 or 2 wrong, runs of 5 and 6 right, 1 or 2 wrong. And what I know there in that situation is that's a lack of attention to orthography. You were there with it for a while, and then you weren't, and now you're back, and then you're gone, and now you're back. So if you begin to see that lack of the executive component to effectively direct attention to orthography start to creep in on performance on receptive coding. Now, one other component here, oromotor functioning, is an oromotor production. It's important to think about this in terms of the way we do it and what we're looking for. The input for the information coming in, see this, say that, see this, say that, okay. If we send information into the system, and it's letters, numbers, and words, then this is where we want, this is the visual input that you receive. If I give you visual images like objects or colors, this is where you're at. So we've just sent you to different places in your brain for you to make meaningful representations of those words. So there's your internal mental representation in different places in your brain. Now what I want you to do is to label them verbally. So whatever color you see on the page, you rapidly say it. And if you're doing that, see, the output is oral motor production. I'm not looking for non-language. I'm looking for language production. So in order to get those color names out of your brain, you have to cross over from the internal mental representation to the part of the brain that you want to label that information. That's one pathway you can travel, but it's not the pathway that we're looking for, which is the one that sees letters and words on the page and syncs those up with language. See, that right there is the connection that I'm looking for when I test. When I want rapid automatic naming, I want it to be letters, numbers, and words as young as possible. If you don't know all of your letters, but you know ABC, you can take ABC and put them on the page randomly and make the child label those 3 letters. It's better than if you label colors and objects because, again, there's a high overlap between the processing in these 2 parts of the brain, but they're different places in the brain. I want you in the land of orthography processing letters and words. I don't want you over here processing colors and objects. So it's best to look at that capacity because they do dissociate. There's a double dissociation here. You can be better at naming colors than words or better at naming words than colors. So we want the words part. So the message here with assessment is if you are assessing basic processes, skills, abilities, and lexicons related to reading, make sure you're doing it with words, letters and words, not anything else. Okay, so once we have that down, then this is the rapid automatic naming task that we might be able to give a child to do. If you can read these quickly and automatically, I know you're able to rapidly and automatically name. Now, can you use executive functions to control your relationship with orthography in your brain? That's an interesting question that is then picked up with the next component, okay? And so this is how you do that. So if rapid automatic naming is a skill, then executive functions have to direct the rapid automatic naming component. If you're going to assess executive functions, it can't do it in a vacuum. It has to be done with something. So we say, okay, with rapid automatic naming as your baseline task, if you can do that well, what do we add to that task to make an executive component that makes you use your executive functions to direct your rapid automatic naming, your use of orthography, and phonology, because you have to name them too. And so what we're looking for here is a cascading production decrement. I give you something, a task that requires the ability, then I add some executive functions to it, and you don't do as well. I add more executive functions, and you do even worse. So the more we can get these step downs, the more we see that cascading production decrement of the skill that you have, or the ability you have, or the lexicon you have, that stored knowledge. It's just you can't use those effectively when executive functions are involved as well, which means I've got to assess the baseline, and then I've got to assess the task, the baseline task plus some executive functions. Okay, so we have to identify them. So this is rapid automatic naming. That's our first step, and here is rapid automatic switching. And in this situation, all I'm doing is interspersing numbers. So now you can't get into a rhythm of reading these sight words that you know by heart. After multiple readings here, usually after only one word, you have to shift to the neural network that retrieves the names of numbers. So now you have to say word, number, word, number, word, number. And that means you're rapidly switching between these two pathways. So you're disrupting the individual's ability to get into this automatic rhythm with rapid automatic naming, and instead they have to control their response to orthography and pull out either a word or a number name. And in having to do that, that's the executive component. And when you see a decrement here, so you see a step down, so they can do rapid automatic naming, rapid automatic switching goes down by at least 3 scaled score points or more, you're seeing the effect of executive functions on an individual's ability to control their rapid automatic naming. This will show up in reading in certain situations when the reading when there's things on the page that aren't necessarily words or letters that you know automatically. So this is kind of a marker for what we've been talking about control of the reading process with executive functions. This is another one you could use, the Stroop test, which is really, it's the Dallas-Kaplan executive function scales uses this called color word interference. The baseline here is just reading these words, green, red, blue, red, as quickly as you can. Then the next one is the Stroop effect, which is don't read the words, but instead say the color of the ink that the word is printed in. So the first one would be red, blue, red, green, red, blue. So you can see how difficult that is because your brain wants to engage and do what it normally does. For automatic, efficient readers who know words well, at least these words, they are drawn to say the word instead of say the color of the ink. They must now use their executive control to inhibit the natural tendency to use your orthographic and phonological processing and instead do something different with it. And for individuals who can't exert that kind of control, you're seeing a lack of executive control of orthography. Again, a marker for the kind of executive difficulties that we see creep into the reading process. This makes it even more difficult, which is say the color of the ink the word is printed in, unless there's a box around the word, in which case you say the word. So now you have to not just inhibit when you say the colors, but then also you have to switch and say the actual word when you see a box. This should be more difficult, but for many individuals, this is actually easier than doing this. And one of the reasons is because here you have to continuously inhibit the desire to read, which places greater stress on the executive function system. So you're continually required to use executive control of orthography. And this is like swimming across the pool, taking a deep breath and swimming underwater to the other side. Okay, can you do that? Well, you have to do it continuously. You can't get a breath of water or a breath of air as you're underwater. Here, those boxes enable you to do what you usually do for a little time period, which means it's sort of like a rest. Inhibit, now switch, and do what you usually do. So once you get past the inhibiting and switching, you can take a little break with your brain. And for some individuals, that little rest, it's like swimming across the pool at the top of the water where you can take a breath whenever you need it. So for them, that helps. Also, the box serves as a visual reminder that you should be using executive control of orthography. So the actual visual element on the page enables individuals to remember to use the executive control. It's basically a visual cue for monitoring and doing what you need to do. And again, I look for that because if you can do this one better than you could do the basic Stroop, I know that you're amenable to the kind of interventions I want to look for, which is putting visual cues on the page, putting asterisks before words that I know you're going to screw up. If I do a cold read, and you don't read words effectively, and they're words you need to decode, and if I tell you what word is this and you can decode it, now I know you can decode it. but you didn't read it in the cold read, I will then asterisk those items, put an asterisk in front of them, and in the next read I'm going to ask you to look at that, and as you read, when you see an asterisk on the page, that means you need to stop, apply your decoding skills, and then take them offline and go on. So in other words, I'm providing a visual prompt that will serve as a reminder that you should be monitoring. And when you are monitoring and you see the asterisk, what do you need to do? Bring your decoding skills online and apply them. Now, gradually over time, you fade those asterisks to the point where they can do it. But having that preemptive warning that you need to use your decoding skills is better than us sitting there and saying to them after the fact, go back and decode that word. You made a mistake. So I'm really kind of trying to train the brain to see this more preemptively, to start proactively seeing what's coming up and the need to monitor rather than doing it after the fact. And that's one of the interventions that I often use with students that are showing me this difficulty with applying the decoding skills effectively in connected text. So there you have word naming. The first, that's the basic skill. Inhibition is the step down, and then inhibition switching is supposed to be a step down, but often we have a paradoxical increase where inhibition switching is better than inhibition for a number of students. So it doesn't quite work the way the authors had intended to work. But that's okay because it tells me a lot about how your brain is functioning and what I can do to help you get better at running your reading show with your executive functions. Okay, so I have in Essential Executive Function Assessment, there's a table in there that gives you these baseline tasks and the EF Plus tasks that you can use. And in Rapid Reference 6.7, I provide examples of these kinds of baseline and executive function tasks, cascading production decrements. Here's an example of what that looks like in terms of explaining oral reading fluency and the cascading decrement that you expect to get. And then here's the way it would look if you are using measures. So you have baseline oral motor functioning measures, baseline word recognition, but when you put the two of them together and you have to go fast, now your Talra sight recognition score is much lower because the integration of your word recognition skills with your oral motor functioning, that's the executive control component that's weaker, which is why your Talra sight word score is lower. You can do the same thing with the Talra score for the phonemic decoding efficiency. Check out your basic decoding skills, check out your basic oral motor functioning. Both of those look good, but your Talra score is lower. You can't integrate effectively to do this as quickly and automatically as you need to. Now, we can also use a process-oriented approach. There's ways to look at it with the assessment component, and I had to really dig to find those cascading production decrements. Let's go back one slide here. Steve Pfeiffer and I are developing a test of executive functions for reading that will give you these kinds of cascading production decrements built into the test and test it across all the skills that we need to develop in reading in some of the lexicons. So we're developing a test to do that in one place, but for now we kind of have to pull a lot of different things from a lot of different places from a cross-battery perspective just to try to get at what we're talking about here. You can do process-oriented assessment where you are observing. So you have the description of the executive involvement in the task. You have a list of the executive functions most likely be involved, and you have a description of the behavior that you're looking for in that particular rapid reference. So cueing the use of orthography, immediate and sustained attention to orthography for accurate letter word perception and discrimination. That's one of the things, one of the executive functions that you have to do with your brain when you're reading. Here are the executive functions that are likely to be involved in that. Perceiving accurately what's on the page, focusing your attention, monitoring your performance as you go. Is this a sight word or is this a word I need to decode? And then correcting if you make any mistakes. Bring this, and actually there should be shifting in this as well. If you have to use your decoding skills, you have to shift to bring them online. You have to execute, which means apply them appropriately. You have to monitor your effectiveness. Give yourself feedback about the effectiveness of your decoding. If it's not right, you have to correct it. You have to redecode the word. So there are actually additional executive functions that you could add in there to think about that may be the problem. So you have, and this is the behavior you see, quick but inaccurate offerings for individual words with no recognition of the errors being made. Words offered are highly similar in visual configuration to the correct word or start with the same letter. We have rhyme and onset. We have the onset being correct but not the rhyme, the other component. Or the same letter or letter combination is the correct word, or the nonsense word when performing decoding tests. So if you give them nonsense words and they substitute real words for the nonsense words, you know that you've got an individual that's doing exactly what we're talking about here, not effectively controlling orthography so that they see every letter on the page and are actually applying and that's an executive function glitch. You should be doing the task we're talking about here instead of pulling in real words. Fluent sentence reading requires the cueing, directing, coordinating of speeded oral motor production, and fluent sentence and passage reading, and prosody for doing that. And so you have executing, pacing, balancing, monitoring, correcting, sustaining. These are the executive functions that you need to use to do that. The behavior that you see, sentence or passage reading, is not consistent with the rate demonstrated during fluency instruction or some forms of assessment. In other words, if I check out your back here, if I check out your oral motor speed and your ability to use prosody, and they look good, but when you try to put them together, they don't look good, then it's usually an executive function component that we're talking about here. Avoiding zoning out while reading, which is a really common problem from an executive perspective. Many individuals have all the skills they need to perform the act of reading, abilities, lexicons, processes. They're all in place. The problem is they can't sustain their reading for more than a minute or two, or even maybe 30 seconds without zoning out as they read. We've all done this at times where you begin to read and you're reading, and then you stop and realize that you just read 3 pages with no conscious attention to the act of reading. In other words, you were an automatic pilot. All that reading that you just did on those 3 pages was done without the use of executive control because you weren't actively engaged in the process of reading to get the meaning from the text. So we need the executive functions to be able to avoid zoning out while reading and keep us focused on the idea that we should be getting meaning from this text. The more of an active reader you are, if you are actively engaged with the text, guaranteed you need to use executive functions to maintain that active engagement. The more passive you become while reading, the more you zone out, the less executive control you have, the more you have no idea what you just read. Although you just read all those words, you just don't know what you read. So focusing, sustaining, monitoring, correcting are required to do that, and a lack of recollection of any of the content that you read, despite the fact that you knew you were engaged in the process of reading. You had a conscious recollection that you read, but you just don't have any conscious recollection of what you read. This is a table within that book, Rapid Reference 6.12, which shows you for different subtests on different tests. Here's a list of observations of what you will see an individual do for that test if there's executive deficits. So on each of these, there are multiple behaviors that you may observe that may be indicative of executive function difficulties. That table, I think, extends over 2 pages, fairly long. That's just a sample of what you see in that. Consulting these rapid references are going to get the job done here for you if you want this in detail. There's also, in Rapid Reference 615, a case study report section describing process-oriented assessment of executive function difficulties affecting reading. So there's a basic description of how this young girl read, the difficulties she had while reading, and how the executive components were involved in that. And here's a short version of, this is a different student, not in the book, but this is a student I worked with, age 11. She had everything there. Speed, automaticity of reading of the words. She could decode words. She could comprehend. When I did all these individual tasks with her, she got scores that were very high in the above average or superior range. But when she had to put them all together to reconnect the text, she would make mistakes, saying "borns for bones" and things of that nature, and not even realizing that she made the mistake and just going on. So her executive capacity to run her reading show was compromised. She could read, she could comprehend, she could decode, and she could do it all quickly. But when she put it all together, the whole system suffered in the sense that she wasn't really reading for meaning the way she needed to in this situation when she was applying it to either a full passage or multiple passages. She just couldn't do that. Over time, her reading became much more improved. In fact, she moved from basic to advanced in 1 year's time when she was 15. Because of all the work that had been done, her brain systems finally caught up. The maturation component was there. The ability to integrate everything with her executive functions improved greatly, and her reading just went up, significantly because she was now able to run her reading show much more effectively than she had been doing. But all the instruction that she received between 11 and 14 and 15 was critical to get her there. Without that instruction, the brain wouldn't know what to do when it finally got there and was able to run the reading show as effectively as it did. So she had practice in integrating all the components, which is what we want. If you read, the more effective you will become at reading, provided you have the skills and the skills instruction has been there and you know what to do with all those components, you will get to the point where you can apply them effectively. So deficits manifest in inconsistencies in the use of all these adequately developed responsible for using the executive functions to coordinate the reading process. I mean, this requires a combination of all those neural pathways for the integration to occur, which means you use it or lose it, or use it to develop it, right? The rich get richer, the poor get poorer. So you need to keep trying to do this to try to strengthen and develop those neural networks that are responsible for the integration of all these components. Otherwise, we're not going to get there. If you just say it's too hard, I can't do it, and you don't try to do it, it's really going to take us a long time. The more the resistance is there to the act of reading, the much more difficult it becomes for the individual to learn. Individuals who are poster children for reading disability often are individuals that didn't have any executive function problems. We taught them the skills they needed to. They applied their executive functions and took off. The true, real individual that's a poster child for reading disability is one that has both reading and producing difficulties and persevered over time with the use of these capacities to practice, even though that was extremely hard for them. They did it, they put in the time, and they got better, not just at the skill level, but also at the executive function level. I mean, that's more difficult to do. There's no question about it. When you have both a producing and a learning difficulty, it's harder going. There's no question about it, and it takes longer. So the most effective form of intervention for these maturation difficulties is practice. Practice the complete act of reading. Put all the abilities, skills, lexicons, processes together. Use the strategies that I teach you when you're doing all those, and keep doing them. If you don't do them, you aren't going to get any better. We can talk about individual skill deficits, though, and executive interventions for those. So I'm referring here to increasing the awareness of and use of all the steps in the word recognition process. So this is a little cognitive strategy instruction script for that. Look at each word carefully. And when I say what I'm saying is intended to activate certain areas of your brain for the executive control component. I want you to accurately perceive what's on the page. Look at each word carefully. Monitor your perception. Is it accurate or not? See the letters and words that are on the page, not the letters and words that you believe to be on the page. Inhibit impulsive retrieval of information from long-term storage and substitution of a word you know for what's on the page. Inhibit that. But quickly, as quickly as you can, figure out if you know the word or don't know the word. That's a gauge. Do I know this word or don't I? Quickly, which is the PACE cue again, say the word if you know it, pause if you don't know it, shift to decoding mode. Quickly use your decoding skills to sound out the word. Ask yourself if what you sounded out matches the words you've heard before, and then you're on your way. Use your decoding skills again if you don't recognize what you sounded out, or if the word doesn't make sense in the sentence. So this is a cognitive strategy instruction script for enabling individuals to do what they need to do at the word level. For a student who appears to be having difficulty with substituting those visually similar words, where they're letting the words become illusions and fooling them, then I'm going to use that same strategy, follow that discussion with word recognition drill, but emphasize the first 4 cues in the sequence. Look at each word carefully. See the letters and words that are on the page, not the letters and words that you believe to be on the page. And then you can use these kinds of lists to help them do that. If you flash these, or if you use them in a PowerPoint the way I did before on a computer, there's only one letter that's changing in these words as you move through the list, and so it could be masked, most, must, missed. They're all the same word in terms of all the letters except for one. So attention to orthography. And then mask, often if you do masked, missed, most, must, and you're focusing on the vowel in the middle changing, and then I switch to M-A-S-K, and instead of switching a vowel, I switch the T for a K. Lots of kids will say masked for mask. Or, so this is the thing that we're looking for here, and then after you know mask, they may say mask for mark. So it's that attention to orthography. See every letter of every word. Otherwise, you will make mistakes in substituting words that you think are on the page for words that are on the page. This can't be emphasized enough as a critical skill that students need to develop, and activities that need to be directed and focused at helping individuals get better at doing this, seeing all the letters of every word as quickly as possible so that the reading can be very automatic. That once you have trained this into place and you have it, you don't need your executive functions to monitor it. But if you make these kinds of glitches, you need to get to the point where you can do it, and practice is the only way to get there. Interventions for executive function difficulties of reading rate, increased oral reading rate. The goal of fluency instruction. This is fluency instruction. The idea here is to develop the capacity to pace yourself. Many individuals, when you engage in interventions like neural imprinting, and you've got that the neural impress method where you use your finger to guide them. See, now you're externally. You're the frontal lobe. You're setting the pace for the reading. As long as you move your finger across the page, they can keep up with you, and they can say the words as quickly as your finger is moving and hopefully comprehend what they're reading, okay? But the minute you take your finger away, they slow down again. You put your finger back, they speed up. You take it away, they slow down. See, that means they haven't internalized the capacity for pacing. They're not using their executive functions to pace their reading rate. They're relying on your finger, your frontal lobe, to do the pacing. So practice. Gradually, it goes from your finger into their head, and they start internalizing that and getting better at doing it on their own without the external cues. And you basically then fade the external cues and get them to do it more in their mind. So for interventions for difficulties with comprehension, strategy instruction is the best way to approach this. There's a whole literature out there on cognitive strategy instruction, especially in the area of reading. Programs like Comprehension Plus, that I think Pearson publishes that. It's a very good program for teaching reading comprehension strategies that enable individuals to become more effective at using their executive functions to direct the comprehension process. Programs like Comprehension Plus have activities built into them that can be used to enhance comprehension instruction to get more of this into what you're doing. So we're looking for these strategies for active comprehension. They're not usually formally taught, but the thing is, without explicit or formal instruction, that can lead to improvement, but we often don't do that kind of strategy instruction. And if you don't do it, individuals tend not to develop these capacities themselves. And so students who are not explicitly taught these strategies are unlikely to learn or develop them or use them spontaneously. At least struggling readers aren't. I think many individuals do learn to use these spontaneously, but most struggling readers do not, especially individuals with executive deficits, do not learn how to use these spontaneously. The idea behind this explicit instruction or cognitive strategy instruction, is that comprehension can be improved by teaching students to use specific strategies to reason strategically when they encounter barriers in comprehension. Comprehension monitoring, that's what we're talking about. So, in other words, executive functions, monitoring carefully what you're reading. Two approaches that are used here, the direct explanation approach, where the teachers help the students view reading as a problem-solving task that requires the use of strategic thinking. You lead them through exercises that enable them to think about what they're reading. And the transactional strategy approach, very similar. It focuses on the teacher's capacity to facilitate discussion in which the students collaborate to form joint interpretations of the text. In other words, now I'm stepping back and I'm saying, I want you to use your brain to figure out what's on the page. I'm not going to give you a lot of assistance with this. I'm not going to structure the discussion as much as I've been structuring it. I'm going to rely on you students to come up with your own questions to ask yourselves to get the most out of what you're reading. But you have to model that ahead of time and teach them how to use that strategy. It's more complicated. It's difficult to use. There's no doubt in the instructional literature that the National Reading Panel looked at that teachers have a hard time doing this. Many teacher-based literature is clear there that cognitive strategy instruction is the best way to approach this process. Executive control. Are you aware of your awareness of what you need to do in comprehension? Move like glaciers. This is basically a discussion now. You could say, what do you think this having a lot of fun leading individuals to the fact that what he's talking about here is the triune brain theory developed by McLean, the idea that so the idea here is that first reptilian brain was set down first, then the mammalian brain, in the way we use these levels of brain, and of course executive control is what we want to get to, and appreciating that and understanding that enables individuals to take more out of what they read and the comprehension toolkit. which are two sources that you should know about for improving reading comprehension. Okay, I think we're pretty good with time at this point. If we could stop here and open it up for questions, I think that would be a good thing to do.
Related to executive function and ADD, and wanted to ask you if you could discuss that differentiation, how they can differentiate.
With a lack of inhibition and a lack of attention to orthography, because many individuals with ADHD are exceptionally good readers. They've learned this. They are able to do that at that level. It's a matter of the direct assessment we talked about, looking, does the individual do this or not? It's not are they ADHD or not, it's do they do this or not? Many individuals that aren't ADHD have trouble directing attention to orthography. That's something they just don't know how to do or don't know why it should be done, and so you have to teach them. So it's not a given that any individual with ADHD will have that difficulty. And you say, well, why don't they? Think about that internal pathway. See, again, if you're motivated and you want to read, you see a need for reading, you like reading, you may be ADHD as all get out, but there's the one thing you want to do is read well, and you're motivated to learn how to read. You bring every possible ounce of executive control you have to the act of reading, and you get really good at doing it. But the ADHD components will show up in situations of external demand where other people are demanding of you to do things other than that. For example, an ADHD individual may not be able to read the book that you want them to read because they're busy reading all the books they want to read. So the ADHD component will start showing up in the external demand components related to reading, not in the basic skill components or the integration of skills. Now, you may have difficulties at that level and be ADHD, but you may have difficulties at that level of integrating and using executive functions to run the reading show and not be ADHD. So the two of them are a lot different.
And we actually have a follow-up question. Is it still called a reading disorder if only ADHD is involved in affecting reading?
Yeah, I don't think it is. It's called a producing difficulty, and I think it really it's more because now you've accurately identified the issue that, and see again, whether it's ADHD or not, if it's not about the skills, if it's not about deficits in process or ability or lack of skill knowledge, see, if it's lack of skill knowledge, that's an instructional disability, not a learning disability. If you have process deficits that prevent you from learning how to read effectively, or you have ability deficits that constrain your ability to comprehend, or reasoning deficits, see now that those are things that happen to a brain that create reading disability. But if it's that you have all the components, you just don't use them effectively, that's a producing disability. And that may happen to individuals with ADHD, but it may happen to individuals without ADHD. And identifying it as you just can't run your reading show, you have a producing disability, enables you to start thinking about the interventions that you need to use to get the individual to become more efficient at integrating all the components of reading. Now you're on the right page for intervention. But if you don't make the distinction, you can get lost in this muddle of, well, what should we be doing, and should we change, jump ship and do something different? And I've had to do lots of evaluations where I have to say, you're doing everything right. All the instruction is necessary. You have all the balanced literacy components. Don't stop doing them. Keep doing them. But you do all that and you break it all apart. When does this individual then have time to sit down and read connected text for multiple pages? And they just say, well, they don't, because we have so many skills to work on individually that we never get to that point. Well, if you don't get to that point, you're not letting the brain exercise the use of all those skills, abilities, and lexicons in an integrated way to actually read. So the connected text reading becomes very critical, and guiding the individual through that connected text reading to enable them to understand how to apply their executive functions becomes a critical piece of that. And that's often the piece that's missing in the interventions when I'm doing evaluations.
We have someone asking about the PAL-2 and whether it can be used at the secondary level.
It's norm referenced only to grade 6. And it's grade norm reference. So I would suggest to you, though, that you can use it in a criterion referenced manner in this sense. If you have an individual that's above grade 6 and they can't even perform at the grade 6 norm reference, they have a problem. So if you've got individuals that scaled scores of 1, 2, 3, 4, 5, 6, or maybe even 7 beyond grade 6, if you could use the PAL with them, and you could identify the difficulties and talk about the fact that even relative to a sixth grader, their performance is weak. Now, the more their performance gets into the average range compared to sixth graders, the more difficult it becomes to interpret the PAL-2 as a criterion reference instrument in that manner. But you can do it effectively when you've got individuals who have pretty significant reading impairments.
And how can the information you shared with everybody today be applied to English language learners?
I think it all applies to English language learners. It's just they've got a double code they have to, and depending on what the emphasis is, are they going to remain dual language processors, or are you trying to get them to just read in English, and you're only teaching them to read in English? Now, if that's the case, then there's all the code switching and all the other components that relate to English as a second language that are there. But they see what this individual would have if you taught them how to read in their native language. These executive deficits would be there. Now you're trying to teach them how to read in English language. These executive deficits will be there, but they may be exacerbated or compounded by the fact that they're trying to learn a second language while doing it. So in the case of English language learners who have executive deficits, they will show up the same way. It's just they may be a lot worse in terms of how they affect the reading process, simply because there's so much that's going on with that individual. But you still have to identify them, understand them, and know that they're affecting the reading of that individual who's learning a second language.
They're asking if you can repeat the reading comprehension resources where you were talking about Comprehension Plus.
Yeah,
is all of that in your reference list, though, Dr. McCloskey?
I don't think those two are, because I think I was going more for a generic cognitive strategy instruction books related to where they talk about reading, writing, and math in all of those books. The ones that are specifically geared, and comprehension is the one that has specific references. Writing does too. And I think I have the writing books listed, but I just forgot to put Comprehension Plus and the Comprehension Toolkit on that list, because they are specific reading programs. They address more than just the executive components or the cognitive strategies, but really most of comprehension instruction that's really good is cognitive strategy instruction. So within those two sources, most of the recommendations they're making for how to teach students to improve their comprehension are cognitive strategy instructions, Comprehension Plus and the Comprehension Toolkit.
Thank you. A question in reference to the DSM-5. For individuals whose primary deficits in achievement are due to production problems, what is the appropriate diagnosis, and how would it change with the DSM-5?
Yeah, I don't think it's going to change, and we really don't have anything. It's stunning when you think that the DSM-4 is supposedly representing the biological nature of mental disability, and yet the definition of learning disability in the DSM-4 is a significant difference between test scores in ability and achievement, which is about as non-biological as you can get. I don't see any changes in that area particularly, although I haven't really closely looked at that. But for the executive function piece, I have, and there's no language that I can see in DSM-5 that even addresses executive dysfunction or its effects, which to me it should be an axis. There should be an axis 6, because everyone in DSM-4 has executive deficiencies. They're either caused by executive function problems, or executive functions are knocked offline by the things that you can't do. If you have subcortical anxiety and it messes up your reading, see, now your anxiety is affecting your executive function. So everybody in DSM-5 is going to show executive deficits. I need to know what they are and how severe they are for me to figure out the appropriate intervention for you, whether you're depressed or can't read or anxious or whatever. Where are your executive functions? How much of them do you have to control yourself? That'll determine the intervention I can use. So there should be an axis 6 in DSM-5 that's an executive function axis where you have to evaluate the individual's executive functions. There won't be. There won't be an executive dysfunction. We'll be back to what Martha Denkla used to recommend, which is call them cognitively cognitive impairment NOS, not otherwise specified, which if you read it, it sounds like you're a basket case cognitively, which is really an inappropriate classification, but that's what she had been using over the years. In some states with education, I've been referring to other health impairment, and just executive deficit, not ADHD, but other health impaired, executively deficient. And I've been able to get IEPs for a number of students in some states using it that way. But for DSM-4, not so much so. For the ICD codes, for ICD-9, the World Health Organization, they have an executive dysfunction classification. I think it's 755.55, and it's executive dysfunction. So if you're using ICD-9 codes, you can get it coded. If you're using DSM-4 or 5, I don't know that you'll ever be able to code this, which to me is a stunning omission from a biologically based textbook on mental disorders.
We've got a couple of questions related to dyslexia. The first is from Richard. Due to the surface dyslexic's tendency to substitute and omit words and reread and lose place in the text, is it possible that surface dyslexia is more a matter of executive functioning than visual orthographic memory, especially considering that many of these readers can correct their mistake when you point it out to them?
Yes and no. I think you're onto something there that certainly with surface dyslexics who overlearn the alphabet principle and apply, they're sounding out every word. They may have seen that word thousands of times, but they're still sounding out me. And you just want to shake them and say, no, just say me. But part of that is that they there are some executive glitches, but also it seems that they're not laying down the lexicon for the sight recognition component. In other words, they don't recognize that word. And so you can't go to the well to draw on what you know already if you don't already know the word. Now you over-rely on decoding skills, and you over-decode, and you continually decode everything that you see. That's more a surface dyslexic component. Now, when you get to the point where they're making those glitches, that's the executive component. And so they may have both. See, they may have that difficulty that we see with executive deficits, and once they do start building a bit of a sight vocabulary, they overutilize it. You might see that. But the bigger problem in surface dyslexia seems to be that inability to lay down a store of sight recognition words that you just instinctively and automatically recognize without having to bring in your decoding skills. They're like decoding junkies stuck on the first stage of decoding. You got to get them off the code. If there's no other way. I mean, you still have to teach them level 2 synthetic phonics to be able to decode effectively, but you want them to understand that decoding is something you only use in certain situations when you don't know the word. For them, that's almost all situations because they don't know many words. So it really becomes a difficult paradox for them. The thing you have to do the most is the thing you don't want to do. The thing you do naturally so well, which is pretty much the code. You need to stop doing that and just recognize these words by sight. And that's that part of it. The instruction is really critical there. A lot of drill sandwiching for these kids and enhancements to what we often do with Orton-Gillingham oriented programs, because the Orton-Gillingham oriented approach, strictly as it's typically used, is not going to help a surface dyslexic as much as we'd like it to. But they may also have these executive glitches too, which complicates the situation for them.
And just one other on dyslexia. How best can we distinguish executive functioning issues from phonological issues in circumstances where the phonological core deficit of dyslexia is, he says it's many of the descriptions given sound much like the phonological core deficit of dyslexia?
I'm not sure I'm quite following where the behaviors that we're observing sound like the phonological core. The phonological core is where you really don't understand the sounds. You can't assign the sounds to words. So I've got to check that out. I mean, if you got good phonological processing, and you can substitute, if I say say flight, now change the full to burr, and you can do that. And you've got all the capacities that you need for lesion and all the other components we're looking for higher level manipulation of subword sound units with working memory. If that all checks out, then the only answer left is you have an executive function glitch. You're not doing what you know how to do and it shows up more when you get into reading connected text. See, so if I sit down and I check out your phonological capacities. Now, if you have weak phonological processing and you're observing these behaviors too, you could say, well, this how do I know which it is? Because I can't see. You can't establish a baseline then. If your phonological processing is so weak that that you have a process deficit, I can't cascade you because there's nothing to cascade. So in that situation, I'm going to work on the phonological piece first. But as that improves and you are starting to benefit from that instruction, if you continue to struggle and you inconsistently use the things that I'm teaching you, one day you use them, the next day you don't, the next day you do, the next day you don't. See, inconsistent application of the things you are learning is more the hallmark of the executive component than the weakness that you have with those components. So we're looking for a consistent application of what you can do at the baseline level. Once we get past the baseline, now, you can use the baseline consistently. Now, if I add this executive component, what happens to you? And now suddenly the things that you were doing consistently and effectively, you're screwing up with because there's an executive component. So I think you do need to kind of try to tease them out. But, the basic phonological components, if they're weak, you got to work on them first. But once they're in place, now you can test out the executive component.
June has a question on students with reading fluency deficits. She says they often have corresponding deficit in word naming speed, but not deficits in letter or number naming speed. She's explained that as via automaticity or letter number recall in the past, but how would you explain it?
Yeah, it is. But see, the word recall is a next step up to automaticity, right? I mean, letter and number, they're short, they're individual, they can be quickly automated, and they're rehearsed, and that's done at a very early age. When you get to words, the orthographic regularity of the patterns within the words becomes critical. It's not just individual letters now. It's clusters of letters that typically are seen in words, and you get better at recognizing those. There's about 2,200 words that are just sight words you need to know, period. They're not as effectively identified as pattern words. But for all the other words, if you know ing, and you know ing, sting, bing, thing, ring. So there's lots of words that you now know. If you know IGHT says ite, night, fight, light, bright, sight. All of those words you have access to because you're able to understand the decoding pattern and apply them. But if you know how to do that, but you see this really effective understanding of decoding, but you don't see the reading being very quickly, even though they know words and they can decode words, and yet they don't do it fast. Yet their rapid automatic naming is there. See, that suggests to me that there may be some executive deficits there related to how well you integrate these components. But it also may be that you just haven't spent enough time automating words, which is the next step up. The orthographic regularity of words. Now get that automated as much as you automated individual letters. As I mentioned, I don't have any specific titles that just are cognitive strategy instruction for reading, and those will be Comprehension Plus and the Comprehension Toolkit.
A couple of assessments.
Place constraints on individuals' ability to retrieve and respond effectively. Some formats are more executively laden than others. And I guarantee the word is difficult. The word they're looking for is difficult, but a lot of students say hard. And I looked at the passage, and the size of the space, the closed size, is about 4-letter size space, which suggests to individuals that I'm looking for a relatively easy 4-letter word, and they say hard instead of difficult. See, that's an executive function trap. When I create in the format little things that your brain picks up and tries to respond to that shouldn't be there, that's a confound. And so I'm just fascinated by how brains can get tricked into these kinds of situations and think, oh yeah, you're looking for a short word. No, I'm looking for a longer word, and the word is difficult, not hard. And you think, well, they're almost the same. Yes, but in this situation, only difficult will do, not hard. And so that's the kind of constraint that you place on brains when you're doing passage comprehension on WJ3 that you don't place on that brain when you do Wyatt or when you do KTA comprehension. And KTA has passages. Many of the times you read a multiple choice question and answer it. So now you don't have to use executive functions for free recall withdrawal. You can rely on me saying, well, would you think it's A, B, C, or D? So that reduces the number of demands on your ability to effectively retrieve the knowledge because I'm giving you a little bit of recognition piece there too. So all three of these formats are a little different. Don't be surprised if you get different scores on all three of those comprehension tests from the same student who has some executive function difficulties.
Thanks
and then that is described. That's discussed in the book in detail. I have a little footnote to it.
Mm-hmm. Thanks so much, Dr. McCloskey. Guys, we've reached the end of our time. Just wanted to say thank you so much for your participation in our spring series. Dr. McCloskey, do you have some final thoughts to share with our attendees?
It was great. I really appreciate the opportunity to discuss this. This is really great questions. I hope you think about this more. If any of you are looking for an opportunity for education in the summer, I'm up on Cape Cod the second and fourth week of July. The second week I do learning disabilities. The fourth week I do producing disabilities or executive functions. Those are all-week seminars at Cape Cod from the Cape Cod Institute. And we'd be talking about these kinds of things in more detail there. But in the interim, the webinars are there. The information is available. We're providing additional sources, and hopefully you find this helpful. Thank you very much. Appreciate it.
Ladies and gentlemen, that does conclude your webinar for today. We thank you for your participation and ask that you please disconnect.